Hitekani Magwedze is live in Limpopo now. Hitekani, good afternoon to you. We can see that you're over a highway. What have been the findings of the tour from the MECs of these two departments?
Well, Stephen, the two ministers of health and community safety here in Limpopo hit about 6 to 7 establishments since the beginning of this morning. Some of those were 2 hospitals, 2 supermarkets, 2 taxi ranks, and then other areas within the Vembe district. And this was, of course, to check for compliance. At hospitals, they found that there were some staff who had no masks or gloves, although they did find that there were systems in place to treat people who suspected that they were positive of the coronavirus. There were concerns that the hospital staff may have not been given the masks that were delivered, according to the MEC of Health, to the hospitals. And she raised this with the leadership of the hospital to say that there is a need. You would remember that nationally there is a call, and there are complaints from the health sector that there is not enough personal protective clothing for the people who are working within the medical field. So those are some of the concerns at the hospitals. But in terms of taxi ranks, we, as compared to Gauteng, where we see partnerships between government and the private sector in terms of supplying water tanks and fumigating the taxi ranks and sanitizing people. There's a lot less of that here, and that also obviously speaks to the lack of resources that this province sees itself in. You'd remember the health MEC in the province, Poppy Ramatuba, had initially called out to people, especially in Gauteng, who stay in Gauteng but are originally from the province of Limpopo, for them to stay there and not travel across the borders and risk bringing the coronavirus into the province, because she was outlining how there is a lack of resources and a lack of infrastructure here in the province compared to Gauteng in terms of dealing with the scourge or with the spread of coronavirus. So quite a number of things that were picked up by the MECs, but in general they were trying to educate communities more than find wrongs from the communities, as it were.
Hitekani, I mean, this is normally the Easter weekend. It's normally very, very busy on the roads. Often, unfortunately, one of the moments where we have the highest death toll if we look through the calendar year. Gosh, on the road beside you, I think I've counted maybe 2 cars going past while you've been talking.
Certainly, Stephen, you probably counted 1 or 2 that passed by, and this is the N1. It's supposed to be the busiest, but you remember the Home Affairs MEC closed the border from South Africa to Zimbabwe, and this is the route that generally goes straight to the border. So since that closure for pedestrian or for the general public, you've seen a lot less cars passing by on the N1. But in general in Limpopo, there are a lot less vehicles traveling around. There are a lot less people on the roads as well. As far as we know, in terms of fatalities on this Easter long weekend, there's been under 2, well, either 1 or 2 fatalities. But the majority of the activity was of people trying to leave Gauteng to come into Limpopo. And we've heard from the Department of Transport in the province that about 7,000 vehicles were turned back on Friday and during the weekend of vehicles coming into the province. And as far as compliance is concerned, on the long Easter long weekend, about 7,000 people have been arrested. 700 people rather, not 7,000, about 700 people in the province have been arrested for breaking those lockdown rules that have been set by the national government. So it's not as busy within the province, but clearly there are people trying to come into the province, and we've seen a lot less deaths, thankfully, this year.
Right, Hitekani Magwedze, thanks very much indeed. Do appreciate that update. Well, I've never seen a highway, especially that particular highway, looking like that over the Easter period. I doubt you have either. It really shows you the impact of the COVID-19 lockdown, doesn't it?